Every year, and we've been saying it for 20 years, every year presents a new challenge for us. HIV can and will escalate rapidly if we don't keep on modifying our prevention efforts, our treatment efforts, and looking after people living with HIV.
There's still a lot of stigma attached to HIV. I feel like we've still got a long way to go in changing that perception. It needs to be something that the community, really comes together on, because I feel like that shame is so strong.
We need to make sure that our young people have an understanding around HIV, have an understanding about testing and where the best places are to go for that. And the fact that if they are diagnosed with HIV, to then further have a conversation with their local GP about treatments, because it's important to start treatments as early as possible with your diagnosis, so then you're able to live a more healthy and productive life.
I think if you become knowledgeable yourself and you're in one of these Aboriginal communities that tends to have a lot of stigma associated with HIV, try to think about what other people might be feeling in terms of shame around HIV, and try to help them to come to understand. Don't be ashamed, and don't be afraid to reach out and ask for that help.
For me, it's important that we have our own Aboriginal and Torres Strait Islander HIV Awareness Week, because we aren't involved in the mainstream movement, and I feel that this is part of our own movement.
I think the more that we can get it out there, make more awareness, it'll hopefully reduce that stigma and that shame, and hopefully more people will want to go to their GPs or bulk billing surgeries, or even services like myself, or even other clinics, that are that work purely on HIV, screening. If we can raise the awareness and more people get screened, I think that's a bonus.
Get everyone talking about HIV, encourage people to go and get tested for HIV. Just start talking about it like it's a normal health condition. Don't stigmatise it, just get out there and talk about HIV.